Okay, guys, how we doing? Colin here from Compass Physio. So we're doing our monthly check-in with our expert in children's physio, Aoife. So Aoife is going to talk to us today about growing pains.
Yes. So, growing pains, that is something that we quite often get into the clinic, or children complaining of growing pains. And I thought it sometimes might be useful to understand what growing pains are and how you end up seeing them within your child, if it's something to worry about or not. So, essentially, growing pains in a small person, usually
So,
around.
so just to cut across you there,
No, you go
when you say
first.
small person, do you mean like someone who's
Yes.
5'6" or like a small,
In a
like how
growing
old?
person.
Right. So a
So,
teenager?
yes, so usually you tend to see some growth spurts in young children. They can start kind of quite early on, around the age of 4 or 5, or you might see them again around the age of 11 or 12. There's usually quite big growth spurts within children, and again in teenage years. So they're kind of centered around specific time frames. However, having said that, obviously it depends. Each body is different, and you might notice that your child has literally shot up over the space of a couple of months.
Okay.
Um,
And is it basically that the body is adapting to the growth in the bone? So the ligaments and the tendons aren't adapting quick enough to that length with the new bone
Yes,
structure.
so that is exactly it. So essentially, what happens in a child that's growing, their bones always grow first. So you have this period of time where the bones have grown quite quickly, as they tend to do, and the muscles and the tendons and ligaments don't tend to grow as quickly. So you've got this period of time where you've got extra length in your bone, but the muscles and tendons just aren't long enough, and so they're then pulling at the bone. Um,
Okay.
and that can then manifest itself in these aches or pains.
And with the pain then, is it like a sharp pain or is it more like a toothache type thing?
More often than not, it's a toothache type pain, so like a dull sort of achy pain. It doesn't tend to be that sharp. Although having said that, if you've got a child that is growing and they're already suffering with growing pains, and then they're very, very active, sometimes then that can result in more kind of more sharp type pain. So in the background, it tends to be quite dull, achy pain. But like that, if you've got somebody who's very active and then kind of exercising on top of a body that's already growing quite a lot, that can then manifest itself as more intense pain.
Okay. And so your child is complaining of aches. You've dosed them up on Nurofen, Calpol, nothing's working. You're suspecting growing pains.
Yeah.
What do you do? What do you think?
Usually, typically, it's something that would generally sort itself out. Obviously, like that, you get a little bit of a period where the bones will grow, and then again, the muscles and tendons will catch up. However, if you've got something that persists for any length of time, it might be worth then just trying a few little gentle stretches with your child to stretch out the muscles that are usually quite tight. Um,
Okay, all right. And is there any specific joints like that are normally affected? Like is it like shoulder joint, knee joint? And then when you say a longer period of time, do you mean like it's gone on for 2 weeks or 2 days or 2 months?
Yeah. Okay. So I would say I mean, really, you should be having it. The pain that you get from a normal kind of growing pain should last about a week or two, and then it should settle down. If it's going on for longer than that, then it would probably be one. Then I would probably start with thinking about likes of stretches, etc. There are more common sites for this. So the key points that you tend to see it at are around ankles, so around the back of the ankle. So people can often get kind of that pain kind of round about the bottom of the ankle where the Achilles inserts into the bone, and that can often lead to an issue known as severs, which is a totally separate topic, which I'm sure we'll come back to again. Um, the other points that you'll often find it is around kind of the hip as well. So kind of that front part of their hip where their hip flexor would insert into, that's another common site. And then the other thing that you tend to see is like along the shins as well. People often tend to complain about that too. Um, so it's usually because those big muscles in the legs just aren't growing as quickly as, like I said, the bones are.
But it could be across it could be anywhere in the it could be like your lower back,
It
or it
could
could be,
be,
yeah, okay.
yeah, absolutely. Like they're probably the most common sites that you'd see it, but like that, it could manifest itself anywhere. Like I said, normally these aches or pains should settle themselves out over a week or two. If it's going beyond that, then I would suggest definitely stretches. And again, if that doesn't sort itself out, then you need to seek some other intervention.
Okay. So would you advise, if the child is very active, would you advise rest from that sport or the multiple sports?
Definitely, yeah, and that's a really tricky one because trying to get kids to stop playing sport, well, especially nowadays, is difficult, you know. So, yeah, the key thing is consistently loading an area that's already inflamed is only going to make it worse. So I would definitely look at maybe modifying what they're doing. So if you've got a kid that's playing hurling and Gaelic and rugby and soccer and whatever else, it might be look at just maybe stopping some of those activities. um, I would always try as best possible to advise not stopping everything completely, you know, maybe modifying your activities first. And if that doesn't settle things down, then yes, rest is the only real option then
So
after that.
maybe looking at swimming or cycling, some non-load
Absolutely.
bearing. Yeah.
Yeah,
Okay.
something that's not exactly low bearing, yeah.
Okay. So they've tried the rest. They've tried the stretches, and the stretches would be like, ideally be looking to prescribe them yourself, or is it just general stretches, or what? Like,
Yeah, no, I mean, like I said, typically, you're looking at stretches for the lower body, so the likes of calf stretches or hamstring stretches. And if that's not something that's normal to you or not normal, like if you're not usually participating in sport or you're not sure about it, I would definitely seek advice on what to do as opposed to doing any sort of crazy stretches off steps,
okay.
etc.
And if you're very modest, so just when you say seek advice, like lots of people get advice from lots of different people. So there's Auntie Mary who's had her shins that were sore for years, and then there's Uncle Tom who's had his neck pain and he rubs olive oil into the back of that. So just can you clarify where people should get advice from?
Yes. So you should seek advice from a children's physio. And I think that's kind of the whole point of this. It's just making sure that you're actually getting expert advice from somebody who is used to dealing with children, or would see them on a regular basis. Because you just, you know, you can't be too careful with these things. More often than not, it's something of nothing. And like I said, they will go back or they will go on to play their sports and they'll be fine. But I think it's just no harm in making sure that everything else is fine. There's no other issues.
Okay, and that could be an initial online consult with yourself, so they don't have to travel to Enfield
Yeah,
or whatever. Yeah, so even that we can plan exercises around that, and go through them on the phone or whatever,
yeah,
and then review maybe in 6 weeks or whatever if it's not getting better, and then
yeah.
you'll be able to liaise with the GP and stuff like that as well.
Absolutely, absolutely. And I think, especially with children, it's so key to kind of keep the GP involved because, like that, it's just that worth them knowing that there's been an issue and it's resolved itself, or if there's for any reason they need to be referred onwards, it's always worth having the GP involved.
And can this be a long-lasting thing, or kind of go into adulthood, or?
Not, I think probably what you'll find is you will always, if somebody's had an issue maybe at a younger age, like that kind of 4, 5, 6 age, it might kind of resurrect itself again when they have a large growth spurt, say around the age of 10 or 11. And again, when they go into their teenage years, you might find that it then comes back to haunt them again. But as they grow into adulthood, it shouldn't have long-lasting issues. I mean, it's because it's not an injury as such. It's just that little bit of stretching. Then it should settle down. They should be able to go on to do any normal activities. And especially if they've been taught the right tools to how to manage in terms of stretches, etc., then it should never be a long-lasting issue.
Brilliant. Any other words of wisdom with regards to growing pains before we leave you for today?
No, I think that's
No.
everything
Okay.
covered.
Thanks very much for that, Aoife. I know how much you love doing these chats. So we'll chat to you guys again in a month. And if there is any topics you would like Aoife to discuss or me to ask her questions on, let us know, and we'll definitely be more than happy to do that for you. Take care, guys, and thanks for watching. Cheers. And just finally, obviously, how do people contact you, Aoife?
Oh yes, so you can contact us via the website, so Compass Physio, or indeed via our social media channels, Facebook, Instagram, etc. Or you can phone us at the clinic on 046 954 9456.
And then your email is Aoife,
At Compass.
AOIFE at compassphysio.ie. Okay, guys, thanks very much for watching. Any questions, send them on to Aoife. Cheers. Take care.